Hey, Dr. Pete here. So, what does anxiety have to do with fasting? And I think this is interesting. There's 40 million people in America that deal with anxiety, and many of them are treating their anxiety through alcohol and benzodiazepines. In other words, to cool off and to deal with this sensation that the world's ending or that they have this restlessness, they drink alcohol regularly, and they get a prescription sometimes for benzodiazepines, which are very addictive. Interestingly, alcohol and benzodiazepines are some of the few drugs out there that you'd actually die from withdrawal from. So that's always interesting. And to wean off of benzodiazepines is actually more difficult than alcohol. It's neither here nor there. The reason I bring this up is I think the way that I would connect anxiety and the use of benzodiazepines and alcohol to treat anxiety is because the mechanism for alcohol and benzodiazepine use, the mechanism of action is that it increases GABA in the brain. Okay, so when you have a GABA release in the brain, it kind of cools you off. It's a depressant. So that's a result of drinking alcohol and taking benzodiazepines. A lot of women, in particular, drink wine every night, right? Or have a drink every day. And there's sort of a culture there. Some people might not even know they have anxiety problem. To me personally, I don't think it's coincidence that the majority of people who have anxiety are women, and that there's a culture in America of people drinking alcohol daily, and a lot of them are like moms, who are trying to cool off at the end of the night. No judgment there. But what I will say, what's interesting about fasting is that when you hit ketosis and you start burning fat for fuel, ketones are good for the brain. And one of the things that they do is they increase the amount of GABA in the brain. So in other words, you're feeling this calmness and this coolness, not from alcohol, not from benzodiazepines, not from substances that can cause you to go through withdrawal and have a seizure and die, but you're actually getting it from a fuel source that's healthy for you. Maybe you should consider fasting. And just like I'm sure alcohol and benzodiazepines do relieve the stress at the time, do relieve that sense of anxiety at the time. Could ketones do the same thing for you, given what you're experiencing and going through? It's something to think about.